is Rosa Sandoval. I'm a regional advisor on tobacco control at the Pan American Health Organization and also acting unit chief for the unit of nutrition and risk factors of non-communicable diseases. Welcome to the virtual launch of our publication, Sugar-sweetened beverage taxation in the region of the Americas. First of all, I would like to thank our panelists joining us today. We have Ms. Sharon Oser from the World Bank, Kate Mandeville from the World Bank as well. We have Dr. Abdullahi Abdukardi from ECLAC. We have Ms. Holly Won from GAE, and also our researchers, Arantxa Colchero from Mexico and Guillermo Paraje from Chile. Also, I would like to welcome and thank my colleague from WHO, Evan Blecher, and of course, Lisa Powell, who has been working with us on this publication from many, many months. So thank you all for being with us today and for helping us work on this topic and bring to our member states and our two colleagues in the region this publication. So just to open up the conversation today, I think I just wanted to make a couple of maybe 3 to 4 points about why we're here today. Well, the first one is what we know in terms of the burden of unhealthy diet and obesity in the world and specifically in our region. The Americas, unfortunately, is the region with the highest levels of overweight and obesity in the world. And we know that non-communicable diseases associated with obesity and unhealthy diet create a burden that goes beyond the health sector. And this affects economies of countries and economies of families. And, but the good news is that we do have instruments to address these issues. And but before I go into that, I also want to acknowledge the context in which we're living right now. And it's almost impossible not to talk about COVID-19 whenever we are discussing any topic. And unfortunately, the COVID-19 pandemic has highlighted this clear interplay between a global viral outbreak and non-communicable diseases. And obesity and unhealthy diet can make people more vulnerable to becoming severely ill with COVID-19. And this was one of the first things that we learned about COVID-19. So it is in that sense very, very important for all of us in the public health community, and in particularly for we in PAHO, we are devoting lots of our efforts to discuss and put on the table in discussion with decision makers, what are the cost-effective solutions to address this? And one of these interventions, one of these cost-effective solutions are specifically taxation. Taxation of, in this case, we're going to talk about taxation of sugar-sweetened beverages. And they are what we call it, they are a triple win. They are a triple win because on one hand, they reduce consumption of these products. And this is something that we have found, that we're increasingly finding, we're having increasingly evidence on this topic in our region in particular, but in the world, of course, as well. They generate tax revenue, and they also have, and of course, through that, they have the potential to reduce long-term associated healthcare costs. And I think we all know, and especially in the Latin American region and the Caribbean region, we all know how important it is to have healthy health systems, if you allow me to talk about it, sustainable financially sustainable health systems. We have learned during this past year how important it is and how important it is to invest in that. So we have here an instrument that would allow us to reduce consumption of these products, to generate revenue, and to also contribute to the sustainability of the health system overall. And but I also want to emphasize that there is no one single policy that will help us address the issue. This intervention, taxation of sugar-sweetened beverages, is part of a comprehensive package of interventions that we need to use. All the regulatory measures as restriction of marketing restrictions, of course, front of package labeling, and of with the schools and other settings in order to create environments for people to make the right choices and facilitate the right choice. So this is the context in which we're presenting our publication today. One thing that I also want to highlight about the panorama of taxation of these products in our region is that many countries in our region, 21 out of 35 countries, do apply taxes to these beverages. The way they are applied is not necessarily from a public health perspective. In some of these cases, for example, taxation is also applied to water. So we see lots of room to improve how these taxes are applied, but it's good news that the taxes already exist, because then this changes the policy conversation. It's about adjusting the taxes. It's about making them better for them to contribute to health outcomes, but they already exist in many of our countries. So we do see this as an opportunity and a possibility, and I'm very happy that in the group of panelists that we have today, we have a combination of those with expertise on nutrition that come from the health world, and we also have a number of colleagues that come more from the fiscal world, from the governance world and economists. And I think it's very symbolic of what we need to do when we're discussing this issue. It's an issue that goes across disciplines. But I don't want to take much longer on these opening remarks, and I just would like to again welcome you all to our virtual lunch. I hope that you find this publication useful in your day-to-day work, and I hope that we continue this conversation with all of you in the future in terms of how to make better use of this intervention, of this instrument that we have in our hands, and how to bring together different disciplines and also colleagues from different government sectors, Minister of Finance, Minister of Economy, to have a joint conversation on this. So having said that, then I would like to give the floor to my colleague, Fabio da Silva Gomez, to start with the next part of our webinar. Fabio.
Thank you very much, Rosa. And before I go on, I wanted everyone to know that this webinar is gonna be held in both Spanish and English. So just make sure that you select the language that you would like to follow using the interpretation or interpretación button that you find below on the Zoom screen. So I'll just we'll start now just showing very briefly how the document was structured. I think Rosa already mentioned very clearly why this document was prepared. And you now already have online today both versions, the English one and the Spanish version is just came out too. And these are the links. We'll share the links in the chat box so you can access either versions. And instead of doing a slide presentation, then I decided to just go through some of the key parts and just explain how it was structured. And then after that, we'll have a more detailed overview of the content that it's covered, which will be done by Professor Lisa Powell. I believe you can see just share my screen in a way you can see anything I change now, because it'll be changing. So in the website, you will be able to find both versions. If you're one link, you can access the other link too in Spanish or English. And before I move into the publication, I wanted to highlight the acknowledgements and special thanks for Lisa Powell, who did a tremendous job in helping us putting this report together, but also acknowledge gratefully the contribution from Maxime Roche and Steven Constantino from our team at PAHO WHO, Keith Marple and Tatiana Andreeva, which also contribute to Taxation and data analysis, Guillermo Paraje, Arancha Colchero, Chizuru Nishida, Evan Bletcher, JP, Catherine Engelhardt, and Roberto Iglesias helping us reviewing the document. And finally, acknowledge the support of the Global Health Advocacy Incubator and funding from Bloomberg Philanthropies. For you all, we thank you very much for your contribution. So the document is structured in a way, and this report is structured in a way that it brings the key elements that requires us to build the case and tell countries why sugar-sweetened beverages taxation is important in tackling NCDs and obesity. And that what it brings in the first part of the introduction is really why it is important, and why if you don't take this action, you're not gonna make much progress in terms of reducing the burden of NCDs. Then we go into the economic concepts and why and what are the key elements that are necessary to make sure we understand why and how SSB taxes can help. And so here's more the economic rationale and also what are the economic costs that we could be saving in terms of preventing obesity based on this policy tool. Voy a mover el español también ahora. Otro conjunto importante.
I will switch to Spanish now. Another important point of elements that we follow with this publication are these. Once we know in the countries that this is an important measure, what are the key elements in order to design and apply these taxes? For example, structure of the tax, etc. So more elements that will assist countries and now recognizing the importance of this measure, how to enforce this measure in the best way possible. And in another chapter, another section, we will also go into the importance and the possibility of having these measures and for these to be used for tax collection and for generation of tax revenues for the country, and how we can also earmark these resources that were collected through the use of tax collection in order to improve public health in a given country.
In another section, we've also detailed the evidence of the effect of the taxation of sugar-sweetened beverages. And this brings a review of the evidence of their effects on the prices, but also on purchases and consumption. And Lisa will go into more details later, as I mentioned. Then in the fifth, we decided to have a final section that will also address some of the questions. There are common questions that sometimes are argued by opponents of the SSB taxation, and we wanted to clarify those questions that relates to employment, that relates to cross-border when that is the case in for instance in countries where there's county or state taxes. And finally, there's one section that details those studies that I mentioned on section 4 and summarizes the what are the main features, how it was designed. So there's more details if you want to look at. So now I'll stop here. I don't want to tell you everything about the publication because we all want you to access it and read it. And now pass the mic to Professor Lisa Powell, who's a professor and director of health policy and administration of the University of Illinois at Chicago. Thank you very much, Lisa. The floor is yours.
Thank you so much, Fabio, for that overview, and Rosa, and thank you for organizing this webinar, and it's been wonderful to work with you on this report. So I am going to share my screen, and I will give you kind of an overview. So I've selected, there's a lot in the report, so as Fabio said, we encourage you to read it in my presentation. I'm going to give examples, so I've just in some places pulled different country examples, but as Fabio said, there are full details of the body of evidence really can be obtained in the report. So let me see. Okay, so just as an overview, I will cover the rationale for the fiscal policy, the tax design considerations, some empirical evidence, and those economic concerns. So when thinking about the rationale, really what we're talking about is the extent of obesity and SSB related concerns in terms of the health burdens. And what we really encourage is for one to do a situation analysis, because that's going to change from country to country. But the economic rationale and much of the evidence is really can be drawn from, because there's often not particular examples of evidence for a given country. Obviously, if there has not been, if those studies have not been done, but one can really draw from those across worldwide. So really the idea around the rationale is that there's overconsumption, and that's because there's negative externalities that are really not accounted for in the private market. And these relate to medical costs, lost productivity. We detail a number of studies in the report that cover that. And the idea here is often in economics, we call this a Pigouvian tax. Really the idea is to help internalize these external costs and set that tax equal to what that externality might be. And the idea is that we would change the relative costs so that SSBs become relatively more expensive relative to the option that would be the non-SSB. And that in turn would make some behavior changes. And a common metric that we think about, and we're going to show some results in that regard, is the price elasticity of demand. That is, how much would we expect consumption to change for a 1% change in price? And as Rosa detailed in her introduction, although this report is focused on fiscal policy and taxes, this really needs to be thought of in terms of a comprehensive policy approach. And in terms of costs of obesity, there are many. We can think about in childhood, there's evidence that there's poor physical, mental health, children obtain lower test results, there's school absenteeism, delayed skill acquisition. We know that childhood obesity tracks into adult obesity. There's costs related to physical and mental health in adulthood, presenteeism, absenteeism, lower wages. So all of this in essence leads to what an economist might call lower utility or just lower well-being overall. And unfortunately, these are often disproportionately borne by individuals who may be, for example, lower income or from a certain region. As Rosa said, different parts of the world, different parts of even within countries and areas are affected differentially by obesity. And then this becomes a cycle. So when one's thinking about imposing a tax, there's a lot of design considerations. There's the base, what that is, what is the tax going to apply to, what type of tax, what rate to set, whether it's a tax that's per unit versus ad valorem, and I'll explain that in a minute. There's discussions versus tiered or flat taxes, and of course what one might do with the tax revenue. So in terms of the tax base, if the objective of the tax is to actually reduce sugar intake and reduce associated burdens as excess sugar intake, then really you want to tax all forms of SSBs. You may remember many years ago when there was much discussion, these were referred to as soda taxes, but soda is simply one form of SSBs. In many populations, a large amount of sugar intake is through fruit drinks. There's sports drinks, energy drinks have a high amount of sugar in them, sweetened teas and coffees. If also the tax is really about added sugar, then we might want to also consider sweetened flavored milk to the tax base. Although I must say in most taxes to date, those have been excluded. And again, if we consider free sugars to be detrimental to health, then actually the base would also include 100% fruit juice. But again, that has also been not generally included to date. But the broader the tax, that's going to help minimize substitution to the non-taxed beverages. So there's different types of taxes, an excise tax versus a sales tax. And with excise taxes compared to sales taxes that are at point of sale, of course, there are VAT taxes that would incur at the shelf price, but a point of sale general tax, sales tax would not. So what we really want is actually the price, the sticker price, so that when to change, so that when somebody's standing at the shelf thinking about pulling something off the shelf, we want them to see that higher price so it's more apparent to consumers. And also excise taxes appear into the price, often levied at the distribution level, regardless of where the item is sold. So for example, in the vending machine. And then how would the tax be put on? Would it be specific? So that's per unit, i.e. if we were in the US, perhaps 1 or 2 cents per ounce. Or would it be ad valorem, which is a percentage of the price? A couple of advantages of specific versus ad valorem taxes. Specific taxes, quantity discounts are still taxed. It reduces incentives to switch to cheaper brands. One issue with an ad valorem tax also is that when it's levied very early in the value chain, it really has a smaller impact on price because it's levied on a smaller, earlier price, although specific taxes do need to be adjusted for inflation. So I often get this question, well, how large should the tax be? Well, WHO is recommending that roughly we increase prices by at least 20%. We've seen prices, rates equal to approximately 10% in some of the regions of Mexico, Barbados, for example, Dominica. And there's quite a range in the US from 1 to 2 cents per ounce. And one thing I'd like to note is that when you have a specific tax, if it's a function of the volume, for example, because these items have different tax prices, the percentage is going to be different. So soda and juice drinks are fairly cheap per ounce. So a 1 cent tax, for example, there would raise prices by, say, 28 or 37% for soda. But because energy drinks are quite expensive, a 1 cent per ounce tax would only really raise the price by 7%. So one might also think about differential specific rates if you wanted to raise the price by an equal percentage across the different categories of drinks. And finally, I just want to make mention of the tiered tax. We see, for example, in the UK, they've got a tiered tax, and their rates equate to about 7 and 9% for the cents per ounce for the 2 tiers. But really, you've got to think about what your distribution looks like. And my colleagues and I had worked on doing this for the US, and so in order to figure out where you would actually put those tiers, you'd want to actually place them a significant amount below a large grouping. So you can see that large grouping between 25 to roughly 30 grams of sugar per 8 ounces. So you'd want to make sure that maybe the first tier was down at, say, 20, so that you could pull, and hopefully with reformulation, pull that down and perhaps have those reformulated, or get individuals to switch down to a lower tier. And then finally, in terms of tax design, earmarking, that is setting aside specifically some of the revenue for certain activities, can really help to garner public support, especially if it perhaps is going to be set aside towards low income or minority populations, which can help address concerns that the tax may be regressive or issues around health disparities. And additionally, earmarking could be for nutrition or physical activity related programs, which can in turn complement the intended health impact. So what's the evidence on the impact of sugary taxes to date? Where do they exist? Do they actually raise prices? That is, are they passed on to consumers? And how do they impact taxed and untaxed beverages? The team at PAHO put together this wonderful overview of taxes in the region of the Americas, and you can see that there are a number of taxes in place. Some of them are fairly large, some of them are rather small, but we can see that there's momentum, and these have been increasing. In fact, every time I go to do a review, I see that the number worldwide is increasing. So in terms of whether they increase prices or not. So essentially, you can think about the tax is really just an instrument to change the price for the consumer. If it's undershifted, it means that, say, a 1 cent per ounce tax is not fully passed on. And you can see in a number of places that is the case. Full pass-through is that the tax is pretty much or close to full pass-through is passed on. You can see studies in Mexico showed that it was. You can also see from this that there's different studies find different things, right? They have different samples, and that's one reason why we need a fair bit of evaluation. But some studies have found that the Seattle tax was passed through, some have found that it wasn't. And then some find that there's actually overshifting, as was for the Cook County tax. So how does this impact demand? Demand can be measured by consumption measures. Individual surveys can be measured by purchases. It can be measured by scanner data of volume sold in stores. And so what we've done in this example here is that we have pulled all papers that were published in peer-reviewed journals, and we've used the price elasticity of demand as the common metric. And you can see here that overall what we found was that on average, taxes that raise prices by 10% would reduce demand by 13.6%. And that equates to an elasticity of minus 1.36. So as another example, if you wanted to have a higher tax, if you had a tax in place that increased prices by 25%, you would expect on average demand to be reduced by 34%. And this is actually not based just on price models, but actually of tax evaluations of taxes that have actually been put in place already roughly over the last 6 to 7 years in the region of the Americas. So I think really the message here is that SSB taxes do reduce demand. So a couple of examples on, well, is there a substitution? What's going on? Are people substituting to other beverages? Are they drinking tap water? Most studies do not measure tap water because they're looking mostly at purchases or sales. On the few that do would look at consumption. But in Mexico, it was found that there was substitution to water. Barbados, non-SSB sales were not particularly water. But in the US, there was a mix. Some substitution was found to water. Some found no substitution at all, Philadelphia and Cook County, which may have meant that folks were already overhydrating or that they were substituting to tap water. And I'm going to come back to that because there's issues around whether or not tap water is actually safe to drink and is a viable alternative. So what are some concerns related to economic impacts that are raised? Regressivity, that is the distributional impact of the tax avoidance in terms of cross-border shopping, and job loss. Well, in terms of regressivity, I think what we need to keep in mind is that in many instances, often higher rates of diabetes or obesity may be disproportionately borne by individuals who are in fact in lower income parts of the population. We know that lower income populations tend to be more price sensitive. So from a behavior change point of view or a health point of view, the tax could be thought of as progressive because those individuals who are lower income will actually change their behavior to a greater extent and helps yield a higher health benefit. Nonetheless, there are issues related to the economic impact of the tax. And one aspect that could be considered would be that the return of the benefits through earmarking could be that those tax revenues are actually dedicated and directed to low-income individuals. And one could think about something like a subsidy for fruits and vegetables that would, on the one hand, you would have a tax that sugary beverages become more expensive, and on the other hand, you would actually make healthier items in the diet and the grocery purchases cheaper. The other item is the fact that tap water is free, but there's a substantial problem across, I think, the entire region of the Americas to ensure that we have quality drinking water. So infrastructure could be, dollars could be redirected towards ensuring infrastructure for healthy tap water. What about cross-border shopping? Really, that's most relevant for local area taxes, which happens generally in the region of the Americas. Most taxes outside the US have been national. And there's some evidence that's come out of the US where the offset has been almost a quarter of the impact, 24% in Philadelphia, 22% in Cook County, although in Seattle there was no offset. So there's somewhat of a mix. Yes, there will be cross-border shopping. Individuals are rational. They are going to try to avoid the tax, but it certainly by no means erases the impact of the tax. And finally, job loss. This is an argument that's been made through taxation related to tobacco, alcohol, and now with SSB taxes. One thing to keep in mind is that often industry might note that there will be job losses, but they don't account for the fact that if you don't spend $1 on the taxed item, say the SSB, you'll spend that dollar on something else. So the money doesn't disappear from the economy. There's just a reallocation of funds. So there's some substitution effects and the tax revenue is spent. Evidence from Mexico has found no changes in employment associated with SSB tax there. And similarly in Philadelphia, 2 studies have shown, one, that there's no impact on unemployment claims and no impact overall on employment. So finally, I just wanted to conclude by sort of stepping back and thinking about moving forward. It's important to understand the context and the health issues and the full range of costs, the situation analysis for the jurisdiction that you're in, to have the evidence base, which we've tried to provide in this report, and there's a very detailed appendix of the studies. Thinking about tax design, that has to be thought of in the capacity of the jurisdiction. If there is already a tax structure in place that would make it cheaper for tax administration, then it may be best to figure out how such a tax might be incorporated within that tax, but to be sure that individuals face that tax at the shelf level. One can estimate revenue generation. That's in the report. I didn't talk about it here, but we give some examples on how that can be done. Thinking about how best potentially to use those revenue, address, be armed and ready with concerns, because these are real concerns from individuals who are on the ground. It's not just industry, it's individuals on the ground who are concerned about job loss. Cross-border shopping is an issue, and again, impacts on low-income individuals, and to have a plan on how to address those. And finally, to address concerns related to the burden of implementation and how the tax will be operationalized. So a comprehensive policy platform is needed. We saw that with tobacco. Not only were there taxes, but there were restrictions related to where you can smoke, what can be advertised. So all of this should also be considered. Do we allow SSBs in schools? Do we allow advertising to children, for example? So a comprehensive policy platform is needed. And finally, I guess being an academic, I would always need to put in a plug for a comprehensive evaluation, because I think that is, of course, what we need, not just of the intended effects, but also the unintended effects, because that is really critical. We want to know what works and what doesn't work, and how we can create the most effective policies possible in order to impact and improve population health. If you have any questions at all about the report, I, with folks at PAHO, and I would also be more than happy to provide you with any additional information or to share these slides. And my email address is included here. Thank you so much.
Thank you very much, Lisa. That was a great overview of the publication, which has so much to say in a very short period of time. Thank you very much. We're now moving to our panel discussion, which is really an opportunity for us to extend this conversation and get into more details and more challenges that we need to discuss and that our countries are facing. So I would ask our panelists for them all to turn their cameras on. And I think the best way for us to start is to get a clear understanding what SSBs, sugar-sweetened beverages, are, and how they affect health, how they affect other dimensions of society. And I think the best person for us to start with is Professor Marion Nessel, which is our professor of us all on nutrition and public health. And Marion, so would you could let us know what are SSBs and what are the impacts they're having on health and other dimensions of our lives?
Well, thank you, Fabio, and thank all of you for inviting me. I wish we could all be here in person. This is a very strange way to be talking about these things, although I suppose we're getting used to it. I'm happy to talk about sugar-sweetened beverages, the main ones are sodas, carbonated beverages, although there are also sugar-sweetened dairy products, sugar-sweetened juice products, and other kinds of things. But I'm mainly going to be talking about the carbonated beverages because those are the ones that people drink the most of. And drinking the most of them is really the problem because sugar-sweetened beverages are, in public health terms, low-hanging fruit. They're a really easy target for intervention because they contain sugars and water and virtually nothing else of any nutritional value. They have a little caffeine, they have a little sodium. It's in too low amounts to count for very much. So what you're dealing with is sugars. And sugars make foods taste good, but everybody would be healthier consuming less of them because they have no nutritional value other than calories. So the issues in sugar-sweetened beverages are what is sugar doing to health and what are the calories doing to health. And what's astonishing about the sugars, and I can never get my head around it, is how much sugar there is in sugar-sweetened beverages. 50 grams in a standard serving size, which is roughly 1/3 of a liter. That's a lot. That's really a lot. Most dietary recommendations suggest no more than 10% of calories per day from added sugars. That means one standard portion, 1/3 of a liter, takes care of 200 calories. That's, 10, that's it right there. That's your sugar for the day. So the calories are an issue, the sugars are an issue, and the sugars are an issue because of the relationship of large amounts of sugar in the diet to poor health outcome. The calories and the sugar combined are involved in higher risk for obesity and for everything that obesity is a risk factor for. So that means primarily type 2 diabetes, but also heart disease, and these days, COVID-19 without question. So this wouldn't be a problem. Nobody would care if people were just drinking little tiny amounts of these things. But for many people, they substitute for water, especially in places where water supplies are contaminated. And the soda industry has gone to extraordinary efforts to introduce sodas as an acceptable and desirable substitute for water. And so there are people who are drinking 2 liters a day. Sodas are sold in 3-liter bottles in Mexico and other places in Latin America. A 2-liter bottle of Coke or Pepsi is 800 calories. And that's a lot on top of whatever people are eating. I'll say one more thing about that, and that is that those calories are unrecognized. The sugars are unrecognized and the calories are unrecognized. People who are drinking these things do not realize how much sugar they are taking in. They do not realize how many calories they are taking in, and they do not compensate for the excess calories in their diets. And there's loads of research that shows that now. So I tell everybody, if you're trying to lose weight, the first thing you do is stop drinking sodas. When I wrote my book, Soda Politics, a couple of years ago, I didn't write it as a diet manual, but people contacted me afterwards and said, I read your book, I stopped drinking sodas, I lost 10 pounds. I read your book, I stopped drinking sodas, I lost 80 pounds. That was the record. So everybody should be drinking less of these things.
Thank you very much, Maren. And I think, that's very, very clear message for everyone, starting by saying that, when we do reduce that, we have a benefit for health and for life. And one of the other things that you mentioned is really important, how these products are superfluous and they could, disappear and actually make a benefit for us. And I think that's also has an implication for the economics and all concepts that are necessary and are based on are the basis of the rationale. So now I'll move to Sharon Osser, which is a senior governance specialist of the World Bank. That if you could tell us, Sharon, how can taxes positively affect health, and how can countries overcome and this policy coherence, or meaning how they can make public health policies coherent with fiscal policies, given that we already know, especially for in this case, but all other unhealthy commodities, that they're needed to get reduced.
Thank you so much, Fabio, and thank you for having me, and congratulations on the report. It's really excellent. Building on what's said so far, I want to emphasize that taxation is not only about raising revenue. There's a very powerful dimension to taxation that is through improving human development outcomes, because taxes affect individual and firms' incentives and in turn behavior. And there's really nowhere more evidence for that than health taxes. Lisa has already, I think, put us on a really good path explaining the economic logic behind SSB tax that builds on the classic principles of externality correcting taxes. And she also touched upon this, but I want to emphasize it because it's so important. There is a growing body of research in behavioral economics that indicate that people sometimes ignore harmful effects to themselves because there's misinformation, because people discount the consequences, negative consequences in the distant future, and as Marian was mentioning, the aggressive over-marketing. These costs are called internalities. And it's really important to understand that internality costs are largely borne to poorer parts of the population. So while externalities and internalities broadly function similarly in terms of welfare impacts, poorer consumers will benefit more if we can correct these internality issues. Resilient and inclusive recovery from COVID crisis require investing in people. Perhaps one of the most acute challenges facing countries today is to find enough fiscal space for priority of public spending, especially human capital investment. I'm so sorry, I'm gonna take a second to drink water because I have a little bit of a problem. If you can come back to me, apologies for that. Maybe Fabio, you can move on to the next question and you can come back to me. I'm really sorry. There's something stuck in my throat. Sorry.
No problem, Jen. We are all used to this, and we have such a great number of panelists. We can move to the next one and then come back to you. Thank you so much. Just please drink water, not a soda. And so let me go now to my colleague, Dr. Evan Blecher. He is a fiscal policies for health specialist at WHO. And Evan, we briefly touched on this, but if you could please explain to us why health taxes, on tobacco, alcohol, SSBs, why do they represent a win-win-win policy for governments?
Thanks for that question, Rosa, and also thanks for the invitation to be here. We're very happy to collaborate with PAHO once again. I remember receiving the draft of this, or the first draft of this report last year, and being very excited about it because it was so comprehensive, and you guys beat us to it. And also want to acknowledge some of the people on my team. Mr. Jeremiah Paul is the unit head. Unfortunately, he can't be here today. We've got a big launch of a manual on Monday, which is a bit preoccupied with. And also thanks to my colleague Itzia for helping on the preparation for this. Yeah, I think people like to think of health taxes broadly, whether it's tobacco or alcohol, obviously the ones that have historically received most of the attention. And in the last sort of decade, maybe SSBs, as well as this win-win-win. We could also even call it a win-win-win-win. I know it starts getting a little bit too many wins here, and maybe that becomes unbelievable. But what we do know is that taxes, or increased taxes that increase prices of products, are able to reduce consumption. And it's important that we look at the taxes about how they influence prices. If we walk out onto the street and find a person drinking, a soda from a can and say to them, what's the tax you paid on that? In most cases, they're really not going to know. But if you ask them what the price is, they'll tell you the price that they paid, and they'll know how that price varies between different products, different places, different sizes, etc. So it's the prices that influence behavior. But we know that prices, increased taxes that increase prices, reduce use. And it reduces use through different mechanisms, and they vary between products. It can increase cessation, which is probably most important on tobacco. It can reduce initiation, particularly amongst the youth. And it also reduces intensity of use for continuing users. And some of the best evidence we have on this, as Lisa mentioned, in terms of price elasticity studies, come from the Latin American region, where we've had a really big sort of burgeoning movement of doing systematic reviews on these elasticities over the last few years. So, reducing use is going to reduce the health-related conditions and illnesses and injuries that result from it. On SSBs, we look at obesity and as the sort of condition, whereas the illnesses, for instance, like diabetes, on smoking, the direct link between use and the illness is pretty clear. And even on alcohol, where we look at the ability of tax increases to reduce injuries and to reduce heaviness drinking. We also know that increased taxes increase revenue. It's sometimes a bit of a misconception that we can increase a tax that reduces consumption, but yet our total revenue pool is going to increase. And that occurs because of this inelasticity of the product, that the decline in consumption is less than proportional to the increase in prices. And that's pretty consistent across the products, probably more so for tobacco than on SSBs, but still, nevertheless, we do see that relationship hold quite strong, and thus we find increased revenues. That revenue is important. Governments cannot provide important social programs, social protection, health, etc., education without revenue. That money's got to come from somewhere. Third, we also know that the reduced use, and that's the reduced illnesses as a result, are actually going to save health systems, whether they're public or private, are going to save health systems a remarkable amount of money. What we know, particularly with SSBs, is that a lot of the illnesses that come as a result are particularly expensive to treat, and are particularly expensive because we have to treat them over very long periods of time. Diabetes, type 2 diabetes, it's induced by poor nutrition. We're going to have to treat people with those illnesses 20, 30, 40 years sometimes, and it becomes incredibly expensive. The fourth one that often is misunderstood most is how this can influence and positively influence health inequalities and reduce health inequalities. I think it's something we can come back to at a late stage. I know there's going to be a lot more discussion about this, but all we know is that in many cases, it's the poor that have a disproportionate share of the health costs, of the illnesses from the consumption of these products. In many cases, they're marketed very aggressively towards lower income communities. We also know that low income households tend to respond more or in greater proportion to tax and price increases. So they're likely to reduce their consumption by more than richer households. And we also know ultimately that the revenue that we're going to raise from this, when it's spent by government and goes into social programs, that social expenditure disproportionately benefits the poor. At least it should disproportionately benefit the poor. Maybe sometimes we need to spend more time ensuring that takes place on the expenditure side. But conceptually, I think that's an important outcome in terms of the expenditure and the programs that it allows.
Yeah, thank you so much, Evan. So 4 wins so far.
4,
exactly. Thank you. And may I ask Sharon if she would like to finalize her comments maybe at this moment?
Yes, I'm really sorry about that. It's just really rare that happens, but drinking water and feeling better. Yes, so just to emphasize, I mean, COVID-19 crisis, I'm looking at this from a fiscal point of view, and COVID crisis certainly has made an already difficult situation where countries were burdened with unsustainable debt even worse. So both public expenditure and health expenditure has increased. very few high-income countries can sustain these high levels of expenditure. So really, we need to resolve the domestic resource mobilization issue. We need to redouble our efforts on the domestic revenue front. Having said this, we also understand this is really difficult for many countries to achieve. A lot of countries that are low and middle income are still below 15% of tax to GDP ratio, which we take it as sort of like a rough benchmark of being able to provide the minimum basic services for human development. And it's very difficult to increase taxes during a pandemic context where people are hurting. It's very difficult politically. But also there's some, I think, sense of hope because people are realizing all around the world that public services are important, public health is important. And I think when the case can be made really well, people are willing to contribute to the public pot more. And I think there's no more evidence than the case of health taxes where people would be justifying why this is a good idea. And to that extent, I think Lisa's intervention, and this is also covered really well in the report, earmarking SSB tax revenue to some extent can be a powerful tool. The political economy rationale behind it is very strong. So let me stop there, and I apologize again for the little hiccup.
No problem, Sharon, and thank you. And yes, the political economy of this, right? I think we've many times discussed how strong the evidence is, and then yet we are not utilizing this instrument as much as we could. But we will come back to this and with you, Jaren, later today. So let me move to our next panelist, Ms. Holly Wong, Vice President for the Global Health Advocacy Incubator. Hi, Holly, thank you for being here. And one question for you. Why is SSB taxation an essential policy tool to tackle obesity and NCDs as part of a comprehensive approach, as many have mentioned today?
Thanks, Rosa. And let me congratulate PAHO on the launch of this important publication, and also to thank you because it's going to be a very valuable resource for our work and that of our partners in many countries around the world. So SSB taxes, of course, are certainly one important policy tool in trying to address NCDs and obesity. They're not the only policy tool available, and by themselves, SSB taxes are not going to solve this problem. And as you laid out very well in your opening for this morning's session, they're part of this broader package of policies that together can create a more healthy food environment. So these policies can build upon and complement each other. And in total, they can decrease the demand for unhealthy food products, but also to decrease their supply. So those policies, I think you mentioned them earlier, that could work together include front of package nutrition warning labels, restrictions on the marketing of ultra-processed foods and beverages, particularly to children, and restrictions on their availability in school environments. Now, ideally, these tax policies would not only incentivize a behavior change by consumers by purchasing fewer of them, consuming less of them, but also by companies. Many of these beverage companies could focus on more healthy alternative products like water that are part of their product portfolio. And as Evan just talked about, these taxes, of course, generate not only health benefits, but also fiscal ones. So there's really little downside to them. Now, SSB taxes by themselves are not going to solve the problems of obesity and chronic disease. And we need that broader array of policies to be in place. But the fact that we need all of those policies together should not be used as a justification for failing to implement any one of them. In other words, just because you can't move forward with everything at the same time, you should not fail to act. And I think that moving forward with SSB taxes, in the first place, as Marianne said, it's almost the lowest hanging fruit and maybe the easiest first step to take. And obviously numerous countries in Latin America and the Caribbean have already done this. And it's a great step to beginning to create a more healthy food policy environment. And so it begins to sensitize not only policymakers, but the general public about what are healthy and unhealthy foods. And I think that's a good reason to kind of start with that and hopefully lead into some of those broader policies that we also know are needed.
Thank you, Holly. And I think now we could, voy a cambiar al español.
And I will switch it to Spanish because I'd like to ask a question for Guillermo Paraje. Guillermo, you have studied a lot the impact of these taxes, not only on SSBs, but on other unhealthy products or goods. And would like to hear from you a summary as to how we're doing with the evidence on the impact of taxes on these beverages, on prices and consumption in our region. Well, thank you very much for the invitation. And once again, I'd like to join in the congratulations for the excellent report. I'd like to start off by saying that one of the things, it seems to me, that is more impressive about the report is a map showing all the countries that have taxes on SSBs in the region. This is something that we usually didn't know it existed, and it's quite striking. It's surprising when you start seeing the number of countries that do have it. It's also surprising to see that these taxes are low. It means that they not really exploit the potential that taxes on SSBs have in order to reduce consumption. What we know is that in those places where taxes have been enforced in a resolute way, the impact on consumption has been significant. We see an increase in prices as a result of the increase in taxes. Sometimes taxes have been surpassed, and these have been transmitted to consumers. In some other cases, they've been shared with the consumers in a lower share. But what we know is that when you raise taxes, you see an increase in consumption, and there's no doubt about it. So we have evidence, it seems to me, in the region, in Barbados, for example, in Mexico, and Arantxa can talk about this much better, in the US, in Chile, countries that have raised the taxes. And in most of the cases, they've done that in a moderate way, I would say. But even with those moderate increases, they've brought with them reductions in consumption, as is predicted or foreseen by the theory. What I'd like to see, or what we're still missing, I would say, is the impact that a significant increase in taxes could have on consumption in the region. We'd like to see that some country or some countries, hopefully many countries, will follow this and will increase these taxes, and to see the impact that they have not only on the consumption of the goods taxed, but also substitutes, which is also important, as Lisa mentioned. So it seems to me that perhaps this is missing, not because we haven't done that, but we still have not had a country that moves in that direction. Now, we've had countries that don't have to do with the taxes, but it seems to me that it's something that I should bring up. Countries like Chile that have implemented the nutritional labeling that in a way is clear, and we've seen a huge drop in consumption of SSBs. So they just implemented this labeling, and as soon as they did it, consumption dropped between 20 and 25%. Which is unbelievable. So this simply means that the consumers react. So all this history, all this story that people don't change their consumption habits, that taxes are not enough, or that these measures are not sufficient, are not based on reality. People react. you raise prices and they react to changes in the information that you give them when they have a nutritional labeling. So it is to be expected, hopefully soon, that we will have a significant increase in taxes in the region, and that they will have an impact, and they will be able to show a clear impact on consumption. Hopefully, it will be a matter of time so that we can see that. In any case, in the report that we have sufficient evidence in order to show that, in fact, taxes reduce consumption in a significant way. Excellent, Guillermo. Very good comments. The importance of this synergy with other policies that were mentioned by Connie. The very clear evidence that not only the countries that have taken actions and measures have moved forward, but also the need of going beyond, because so that we can also evidence. If we don't take any actions, we don't have any other evidence, but to support actions, we need the political innovation in order to move forward. And it seems to me that Mexico is our best example in connection with innovation in terms of taxes on SSBs. And it's a pleasure to be able to have the participation of Arantxa Colcher, researcher from the National Public Health Institute in Mexico. And she's been very helpful throughout the region in showing the impact that this measure has had in Mexico. And it would be quite good, Arantxa, if you could tell us in a summarized way, how much evidence have you obtained and have you published on this? But how in Mexico you've made progress with this implementation, and what has been the impact of prices on the consumption of SSBs in recent years? And also, let us go into another issue that has to do with this differential impact of consumption, for example, in different population groups, income groups, or also changes in intensity of consumption. If there's something along these lines that you could add to your comments. Thank you very much. Yes, of course. I apologize that I came in late. I don't know why I thought that it was Eastern time, and I thought that it was an hour later, so I apologize. Thank you for the invitation. I'm very pleased to be here. And let me tell you in a summarized fashion what we've found for Mexico. The first thing we saw is what have happened with the prices. And it is very interesting to say that we found that as an average, prices in total went to urban areas, but slightly less in rural areas, where in fact the elasticity is greater. So the fact is that the industry is very well acquainted with how the market works. And the transfer of these prices was differential, although given that urban areas represent 85% of the country, the fact that there has been an increase in the same proportion as the tax is something positive, because we could have expected to have a drop in consumption. So in consumption, what we've studied and what has been available with the different databases, we have been able to see how positive that result is that we've analyzed household purchases, and we've seen that during the first 2 years, household purchases of these SSBs with the taxes show a drop of 7.5%. And it was also heterogeneous. This reduction was greater, considerably much greater for the poorest, close to 10%. We saw a greatest reduction in high consumers, even though we don't have evidence that they already have conditions or that they're sick. It is possible that they have comorbidities. So obviously we found that the reduction was greater in urban areas and in households with their children. So this is what we found with purchases. And this is a tax of 1 peso per liter, so it is relatively low. we're always hoping, but there's a lot of resistance in order to have or to see an increase in taxes in order to derive greater benefits. But with this tax, we even analyzed whether it had some negative impact on employment. We did not find any negative impact on industry that produces SSBs. And they're produced because to a large extent, they also produce substitutes. Bottled water is greatly consumed in Mexico. In other countries, that this is coming down, but in Mexico, people have a lot of mistrust, and so they buy bottled water. And the stores that sell these products don't show a negative impact. They also sell these substitutes, even small shops. We don't see a significant drop in the unemployment rate. So these are the results that we have for Mexico. There are a couple of studies that even show drops in consumption that are much higher, 15 or 16%. And our studies are more moderate, approximately 70% drop. And I definitely believe that we have to raise the taxes. I agree with Guillermo. And also, I agree with Guillermo and other panelists. It is very important to support it with other measures, front-end labeling, reduction in schools that we already have in Mexico. But I think that it is really important to look for mechanisms in order to provide incentives to people to reduce that consumption. We're missing that. We have to continue disincentivizing what is not healthy and incentivizing what is healthy. And so to think of a significant change in the food system, because it's the only way of really diving into it and being able to achieve it. It is much more complex. But if we don't start soon with that, then we will face another problem, which is the environment. And I believe that there's several measures that could have significant impacts on health. Thank you. Thank you, Arantxa. These were very good points. So showing how progressive the benefit is and how this is addressed to those who really need these benefits in public health. And also the importance of having this synergy with other policies and how Mexico has sought the implementation of this front labeling in order to warn about the product and to strengthen all these policies that will support the progress, these set of measures.
Differential impact. We know that Kate Mandeville, a senior health specialist from the World Bank, has done a lot of work as well with her colleague Alan Fuchs at the World Bank, studying the distributional impact of SSB tax, and would like you to tell us a little bit of the conclusions of your work, Kate, on that specifically. Thank you very much.
Thanks, Fabio. In fact, Alan is also Mexican, so I think he's continuing this culture of innovation, which we saw ably demonstrated by Arantxa. He can't join today, unfortunately. But we would really like, as Jaron said, to welcome this very important report. It was really excellent and a really big step forward. And I think we have a policy window now. We've heard about how difficult SSB taxes can be, and the political economy is very complex. But there's a policy window when ministries of finance are open to any new sources of revenue to fill what is going to be a very severe deficit and debt problem for 2 or 3 years at least. But the first thing, unfortunately, that even if the Ministry of Finances are listening and open to introducing SSB tax, industry and opponents are going to say, look, these taxes are aggressive, they hit the poorest hardest. And with the COVID crisis, we can't introduce new taxes, which are going to add more burden to households at the moment who are barely coping with the current crisis. So it can be this regressivity argument that these taxes hit the poorest hardest can really kill an SSB tax off right from the start. And I think both Jaron, Arantxa, and Evan have laid out the evidence very nicely, and Lisa in her presentation that the health impact accrues more to poorer households, both in terms of the burden of disease and potentially because these households can be more responsive to price increases, they can also accrue the health benefits, which have been discussed by other panelists. But certainly in the short term, it is a concern because poorer households are spending proportionally more of their income on sugary drinks. So there is going to be an impact on the household income. So what we did in a very different part of the world, in Kazakhstan and in Ukraine, we looked at this question in what was an analysis which is called an extended cost benefit analysis. And essentially that looks at the impact on household spending because of price increases in sugary drinks, but it also takes into account the health impact. So it takes into account the decrease in out-of-pocket spending on healthcare for diseases associated with consumption of sugary drinks, like Evan pointed out, diabetes and heart disease. These are all very costly, non-communicable chronic diseases, which have a high burden on many households, many families around the world, and particularly in the PAHO region. And then finally, we also took into account the increase in income from the more years of working life that households will have, that families will have, because they are not dying early from these diseases. So they can be more productive, they can bring in more income for the families for a longer time. And when you take into account all those three factors, the decreased spending, increased spending on SSBs, but also the out-of-pocket spending on health and the increased productivity, poorer incomes actually have a higher income, and poorer households, apologize, have a higher income than richer households. So in fact, SSB taxes, when you take into account this net income effect, SSB taxes are progressive in the long run rather than regressive. And we found in Kazakhstan and also in Ukraine, actually having this analysis ready to present to government, to other stakeholders, to industry ahead of any proposition or introduction of SSB taxes was really important for the political economy. So I'd really encourage any policymakers on the line to think about doing this analysis ahead of time so you have an answer for this very common objection to SSB taxes. Thank you.
Muchísimas gracias, Kate, por esos comentarios. Definitivamente el argumento de regresividad.
Thank you, Kate, for these comments. The regressivity comment is a key argument, and we have to work on it when we want to move forward with this policy. And very interesting information that you're bringing. And I'd like to re-emphasize that for the benefit of our participants in terms of net impact of these taxes. And they tell us that they're progressive and not regressive in the long term. And it seems to me that this is a message that stays here from what you're saying. And I do emphasize that. And now I'd like to go to Guillermo. Guillermo has to leave, and before he leaves, I'd like to ask a question. Guillermo, there is a vacuum in terms of not moving forward with these policies, but we also see that there are gaps and vacuums in terms of evidence and the data we need in order to have evidence on this issue. And you've done a lot of research on that. Are data missing in the region? What sort of data are needed in order to raise evidence on this? And that you have found that we don't have sufficiently in the region. Well, I personally believe that we're not missing data. Once again, in any case, there are countries that have to raise taxes in such a way that we can adequately assess the impact that these significant increases in taxes could have. It seems to me, and let me see, what I've had to do, which is to study in a way how the demand for these beverages will react to changes in prices. What I've seen is that in most of the countries that I've seen, the data exist, and the data are essentially household surveys that measure how much is spent by families at a certain point in time. And in general, these polls or these surveys exist. These surveys are complete and they have a good quality. All countries have those surveys. In some cases, they go back some time, 10, 15 years ago. But in many other cases, they've been done in the last 5 to 7 years. So the data exist. What I think is missing, that exists in many countries, but they're quite expensive. The data are quite costly, expensive, is to have data from household panels. For example, Nielsen or Kantar panels where we follow the specific purchase by households. And we not only have information about what is spent by households, but the socioeconomic characteristics of those households. So in those cases, we can have much more detailed information, much finer information about other variables, not only about the price that could condition the purchase of these goods, these products, and some others as well. These panels in many countries exist, but they're expensive. I personally believe, and it is still surprising to me, because of the data that we have in the region. In general, our countries have good data, not only for these studies, but for other studies as well. We have good health surveys where we measure nutritional aspects of the population. These are surveys that are maybe spaced out in time, but in general, they do exist. And what I believe, once again, is that many times we're missing people. This is what we need, people who want to use the data. And in that regard, we need to make an even greater effort in order to use that information and to produce evidence in that regard. But my short answer from my point of view is that data do exist. Thank you very much, Guillermo. We usually say that the intervention that has to do with the taxes is underutilized. And what you're saying now is that we also have an underutilization of data that we do have available in the region in order to have evidence on this. So we start identifying more tasks.
And I'm going to invite Dr. Abdullahi Abdul Qadri. He is the coordinator of the Statistics and Social Development Unit at ECLAC, the Economic Commission for Latin America and the Caribbean. And Abdul, thank you so much for joining us today. And I have a long question for you, but I know you will be able to handle this one. So our analysis found that 21 countries in Latin America and the Caribbean apply national excise taxes on SSBs. While this is promising, there's a disparity in implementation between subregions because we found that 15 out of 19 countries in Latin America apply these taxes, and in the Caribbean is 6 out of 14. What are your ideas? How could you explain the delay or the less implementation in the Caribbean? And more importantly, how do you think we can move this policy forward in the Caribbean, where SSB consumption and obesity prevalence are really high?
Thank you very much, Rosa, for the invitation to participate on this panel. And let me join other colleagues who have spoken before me to congratulate PAHO on an excellent publication. Not only is it informative, it's what the policymakers need, you know, very succinct and points to what needs to be done and the justification for taking those policy actions. Now, going to your question, it's not where we would like the Caribbean to be, but just to have put it in much broader context. The Caribbean, it could be, Caribbean economies could be broadly classified as services-based or goods-based. Now, the services-based economies are predominantly tourism related or reliant on the tourism industry. And within that, you have the hospitality industry, which of course caters to tourists, and they would like to provide what the tourists want. You know, their customers are king. Now, for the goods-based economies, the manufacturing sector is also huge. And within the manufacturing sector, you have the processed food industry, including beverages. So irrespective of where you fall, whether services based or goods based, the concern is generally that you will kill jobs. And Professor Powell highlighted this very well, as well as Fabio in their presentation earlier on, where one of the points or arguments against the imposition of SSB taxes will be that we will lose jobs. So that creates a situation where in the Caribbean, the private sector tend to have a very huge stake, and then they will say, well, we will lose jobs. And in countries where you have unemployment rate that could be as high as 25 and more, especially among youth and women, that becomes a sensitive political issue. Even though it might not be factual, it might not be based on fact, as the publication highlighted that this is not the case generally. So, but politicians are more sensitive to this. So that creates a situation where, because it's not popular to impose or to start SSB taxes because of the argument that you will lose jobs, politicians tend to trend very carefully. So that's a big factor where we observe a low implementation of these kind of excise taxes in the Caribbean. Now, that's not optimal, so we have to do something about it. So if we are to address that issue, and there are other factors that contributed to the low implementation rate of SSB taxes. But to promote policies that will actually lead to the better implementation, we have to look at exactly what Kate mentioned in her presentation. We have to, because politicians speak in terms of course, popularity, in terms of what the public is concerned about, and money. So they will understand, or the technical, the experts understand why we need to reduce the consumption of sugar-sweetened beverages. Now, politicians will be thinking about, okay, will this be popular? But when you now look in terms of the economic body, then they start to pay attention. And as Kate clearly indicated in her intervention, so this is where you get their attention. And I will go further, that we don't even in the Caribbean especially, we know the health implications and the healthcare cost is high, but we need to increasingly emphasize the indirect cost, the productivity loss, and the private sector also, when you start talking to them, that it actually costs you more because you have these workers that are sick, or even how much you pay to support their health insurance. Then you start seeing that people, politicians and decision makers will start to pay attention, because they know that they are going to spend more to care for those who are sick. And not only that, when these people sick, they contribute less to the economy. So we have to shift the discussion when we engage with policymakers to talk about the economic body, and more importantly, the productivity loss, because they may see the healthcare cost because they observe that in how much they pay to support public health facilities. But the indirect cost is what they may not see, and which studies have shown that it is very huge in the Caribbean. So that's one area that we really need to pay attention to. Over to you, Rose.
Oh, thank you so much, Abdul. I always like the vision that you bring, the views that you bring to this conversation with the Caribbean context. So I really appreciate all the insights that you bring us, and yes, the cost associated to this consumption, and how we can better, how we can build a narrative that help us work this intervention through the decision makers in the Caribbean. So thank you so much for all of this. And then now let me go back to Kate. And so very short question and direct question, Kate, for you. Should countries apply even higher taxes for SSBs containing higher amounts of sugar?
Thanks, Rosa. So I think there is the ideal option, and there's the economic option, which is that usually taxing the most harmful ingredient is seen as the most efficient way to implement taxes. And here sugar is the harmful ingredient, so obviously we should try and tax on sugar content. But I think what was really interesting in your report was that out of this plethora in this bevy and bonanza where PAHO is, the PAHO region is really leading the world. All these taxes have been implemented. Only 3 countries have chosen to implement SSB tax based on sugar content. I think one of you were from Peru, so even Peru has been one of the leaders in that. So I think we have to think about why. What is this reticence? Why have countries decided to go with volume-based taxes or other formulations using tiers? And I think that's because there's other contextual factors, and the decision for each country and each administration is going to be a trade between all of these factors. So sugar content may be more efficient and we can recommend it to sort of academics and economists, but it's more administratively complex. So you've got to take into account your tax administration capacity. You need to be able to profile nutrients on your SSB taxes, which is not the case yet in many countries. And you've got to take into account your local stakeholders as well. So actually the decision about whether to have higher taxes on drinks with higher sugar contents is really a decision taking that political economy into account. And it may be pragmatic to implement a tax which is going to be accepted and work more quickly than one which is the ideal option. And I think it's important to note that perhaps there's different options which can meet the needs of different stakeholders and make it more politically acceptable. So for example, in the UK, where I am at the moment, there's just been a study out which showed that the UK's sugar tax, which is a volume-based tax, but it's tiered. So drinks with higher sugar content over a certain threshold are taxed at a higher rate than lower ones. And that's what Lisa was talking about when she did this excellent work on looking at the distribution of sugar content and those thresholds. And that a study has recently showed that actually that tax has decreased the consumption of sugar by consumers by moving consumption down to lower sugar taxes, lower sugar drinks, but it's also maintained the volume of drinks sold. So it's a win for public health, decreasing consumption of sugar, but it's also potentially a very palatable option for industry because they've maintained their profit, they've just reformulated over to lower sugar drinks. So I think it's more than the sugar content, I'd say. I think it's more important to think about the products which are included and your objectives. So, for example, in many countries, diet drinks or artificially sweetened beverage, diet sodas, haven't been included, and in others they have. And there's emerging evidence that diet drinks can have the same health impact as sugar-sweetened beverage. So it may be, these may have been seen as a substitute before, but it may be better to think about including those, as Lisa mentioned in her talk, as well as particularly juice, 100% juices, as Lisa mentioned, and these milk drinks. And I think there was a question a comment from Jamaica saying that local fresh juices is a very important has a very important cultural significance. Juice producers locally can be a really important stakeholder in industry and opponent of SSB taxes. So it may be the next frontier in public health, but it may be pragmatically that you exclude 100% fruit juices to get the SSB tax established, introduced, accepted, and then you strengthen and widen in further iterations of the tax. So think of this as a sort of a staged process in this fight for public health and revenue. Thank you.
Thank you, Kate. And I think it's really important the point that you made about the context where some countries have been heavily consuming higher or drinks with higher amounts of sugar-sweetened beverages, and countries where low sugar, still sugar-sweetened beverages are also a problem. So not mixing them with water or non-sweetened beverages and exempting them would be important, meaning yes, get higher and higher as the amount of sugar is higher, but avoiding, especially on those countries, to exempt low sugar sugar-sweetened beverage, because they are still sugar-sweetened beverages, and then they can still get that effect, or obesogenic effect that Mary was telling us at the beginning. And because this is not only, I think this is just one element of the design that countries are always trying to decide on how they're gonna go about their taxation policy. I wonder if Evan Blecher could help us in identifying. We know that it's a high heterogeneity in the design of the existing SSB taxes, and in our region and worldwide. But if you could tell us, in summary, what are the key design characteristics of a simple and an efficient SSB tax, given all the different parameters that one country needs to look at, and also how this has been used to one or another side to move that forward, or also as arguments to not do it. So how can we know what is better for all of the elements for the country to move on, but also protect that decision from opposing arguments?
Thanks, Fabio. I think this is actually the part of this work that I find the most intriguing and interesting, because a lot of our experience around health taxes more broadly has been on tobacco, where tobacco markets are far simpler because of the homogeneity of a product. So much of the market is generally occupied by products that are almost identical, with the exception of the branding. What we see here is SSBs is totally different. There's so much heterogeneity within the market, and not just within countries, but also between countries. I think in some countries, in at least in North America, it's so dominated by sodas. If you look at countries maybe in the Caribbean, even countries in Africa, which I'm more familiar with, where it's so much more dominated by fruit juices of various types. And so even that between and within country heterogeneity makes it so difficult to say some, entirely straightforward, like we do on tobacco, where we say, let's just implement uniform specific taxes. Let's tax all the products the same. Let's use volume-based rather than value-based taxes. Let's remove these tiers. Let's remove thresholds, etc. That really works well for tobacco because of the homogeneity. With the heterogeneity of the products, it results in a large number of trade-offs. I'm going to be a real economist here and say everything in life has a trade-off, and this is the same. So, and a lot's going to depend both on what we know about the market, what the policy goals are, but also the capacity of a country. Let's be honest. We look at systems like Kate mentioned in the UK with the tiers, or similar system in South Africa that uses a nutrient based with a threshold, but to ultimately trying to achieve the same thing. They require a huge amount of capacity, whether that's regulatory capacity on labeling and verifying nutrient content, whether that's the administrative capacity to continuously be evaluating that the products are in the right categories, the enforcement capacity. There's so many different elements of that chain. Countries which do have strong capacity can sort of take that one side of the trade-off and say, we want to have these complex systems. The problem is when things go wrong in those sorts of systems, they go wrong spectacularly. And my favorite example is, I think Lisa mentioned about where you put the tiers is so important. A very obscure country to us in this context, but in Mongolia, where I worked on alcohol taxes, they put the tiers at exactly the wrong points, which meant that they made no benefit whatsoever. So they traded off all the simplicity for very powerful outcomes that backfired spectacularly. So I think the critical thing is that when we look at that trade-off, we can look at the simplest solution, which is the uniform specific tax. Let's tax all products the same way on a volume basis, not on a value basis. And we end up with what Mexico has pursued. It's 1 peso per liter, it's $1 per liter, whatever that might be. And then we have these options of doing it. One thing that I want to sort of highlight within this is when we go to something simplistic like the uniform specific tax, which I encourage all countries to look at as the base case. That's your first point of entry, is that those taxes are ultimately working through the demand side. And by that, we're trying to raise the prices of products that have significant externalities relative to the prices of products that are untaxed, that don't have the externalities that we want to substitute to. When we're going more on that demand side, we're going to need larger taxes to achieve the outcomes that we want. When we go towards taxes that are using tiers, using nutrient content, thresholds, all these fancy things, we're ultimately looking at taxes that are going to have a bigger impact through the supply side. And what I mean by that is they're looking at creating incentives for firms to change products, reduce sugar content, shift advertising to lower sugar or even non-sugar products, etc. So the problem is that when we go through the supply side, we're creating more complexity because we're trying to effectively, through the tax system, pick winners and losers to some extent. The real sort of challenge with that is that it takes a lot of effort and continuous effort to do that. You've got to continuously monitor it. But the other side of that is where the trade-off comes, is that we actually then need smaller taxes to achieve those same outcomes to some extent. And to some extent, we're not looking at making aggregate changes to the market. That's exactly what Kate mentioned about how we're trying to shift the market and shape the market. But that takes a lot more effort. And there are not that many countries that even with high capacity have been able to do that very successfully. And that's what we have to, when we keep talking about this innovation, we always refer to 2-3 countries in this case. The UK and South Africa, which for lack of a better, for people who haven't maybe followed on the tobacco and alcohol side, are probably the countries with the most experience on using excise taxes to influence behaviors. So that's the other side. Something else in terms of the sort of the simplicity of the design is, and it hasn't been spoken about much yet, and it's often a point of a challenging point for me, is that we really want to focus on excise taxes. And I know particularly in the United States, there's been a lot of experience with sales taxes, but that's because of the peculiarities of the federal nature of the system in the United States. And that there is not going to be, for political reasons, a federal excise tax on anything, should we say, in the next few years. And what that means is that the taxes are occurring at the state level and even the city level and the county level, as was the case in Cook County. And so when that's happened, it's part of the architecture of the fiscal system in the US that makes it more appropriate. But I want to sort of push countries to the other side and let's work on excise taxes, which are far more powerful in terms of their ability to shape the market, to influence prices. And in most countries, that's what we're going to be looking at. And then the secondary issue about what to tax as well. I think there's been sort of these questions about do we include milk products or sweetened milk products or the fruit juices? And again, to reiterate what Kate said, it's to some extent to understand the market and what we're trying to achieve. But to also highlight how this can actually be really, really challenging. We say we want these taxes to be as broad as possible, so to cover as many of the products that have, if we want to keep it simple, nutrient content, not nutrient content, but calorie content. That's a relatively easier way to do it rather than to start to exclude and include products as some countries have done it. But when we go too broad-based, we end up with the taxes on water. It's actually really problematic then, because we end up taxing the product that we want people to shift towards, whether that's bottled water where we don't have safe access to tap water, or municipal tap water where we do have safe access to it. And the problem when you end up with taxes on water as well is because bottled water in many cases, in a lot of developing countries at least, is cheaper than fruit juices. When we apply the same tax, I think Lisa alluded to this in her presentation, to water and to a fruit juice, the relative change in the water is actually going to be higher, can end up causing people to substitute from water to fruit juices. And so we don't want to end up with those sorts of situations. So while we want to be as broad as possible, we also want to make sure that we don't end up adding taxes to the products that we ultimately want people to be shifting and substituting towards. Because at the end of the day, we still need to drink. We still need hydration. And so we need to make sure that not only are we trying to reduce the consumption of products with externalities, but we also need that then to be substituting not towards other products with other externalities, but towards products that we know are actually going to then improve health outcomes.
Thank you, Aaron. And just to, I think this is a message to part of our countries. From the 21 countries that we have in the region with excise taxes, 7 of them are taxing water together. So we're losing that effect. So it's a very important message. And I think that everyone spoken about tactics of opponents of SSP taxation, and how industry and retailers are trying to, in different forms, interfering on the science, interfering on the policy debate, bringing arguments that are not supported by evidence, trying to weaken regulations, delayed regulations, or even impede such regulations with legal challenges. And we no wonder why Marion Nestle wrote a whole book on soda politics to tell this story, and also another book on how science has been confused and also manipulated by these sectors to try to confuse countries in taking their decision, and trying to make them not take the effective policy making route. So, Mary, I think we will also wanted for you to give us a summary of how these actors are operating, and how could countries overcome and work to overcome these challenges.
Yes. Well, soda companies are businesses, and like any other business, their absolute first priority, their only priority, is to generate profits for their stockholders. And once you understand that, everything that they do makes perfect sense. So their job is to protect sales of their products, and their job is to make sure that nobody attacks sales of their products. And so the soda companies for decades have done marketing, which everybody can see. They advertise, which everybody can see. But behind the scenes, they have also engaged in a version of the tobacco industry's playbook. They followed all of the strategies and tactics that the tobacco industry used to protect sales of cigarettes when there was so much information coming out about how cigarettes caused cancer. And the first thing you do is you cast doubt on the science. So you fund your own science. And there have been many, many examples of soda companies, particularly Coca-Cola, which funded extraordinary amounts of science that was aimed at doing 3 things. First, demonstrating that any research that showed that sodas were bad for health was so flawed that you didn't need to pay any attention to it. Then to show that sugars were benign and were just like any other food and didn't have any particular problem. And then to show that physical activity was more important than what you eat in increasing body weight. And they funded extraordinary hundreds and hundreds of studies. There have now been lots of papers written about these things that show them. So that's on the research side. Then they funded front groups that worked in various countries. ILSI is the International Life Sciences Institute is the most obvious example and the best documented example, which worked with governments to show that the research didn't show that there was any harm for these things and that they should be let alone and not bothered with policies and certainly never taxed. And then there's a lot of lobbying behind the scenes with government to make sure that there are no tax policies passed. And then vast amounts of money in the United States, hundreds of millions of dollars going into government lobbying to make sure that the taxes didn't get passed. So anytime there was a tax initiative in the United States, and certainly throughout the world, a lot of money went into lobbying to make sure that those taxes didn't pass. So how did the taxes pass? That's the real question. Well, they passed because lots of people, I mean, the people that I've talked to in Latin America where I asked this question said we did our homework. We had the research down cold. We had the economic implications down cold. We did absolutely everything to counter every conceivable argument. And we could show that if the tax revenues went to something that was for public health purposes, that there would be great popular support for the taxes. And that's happened, and that's how this happened in Latin America, and that's why this report that has come out is so terribly important, because it puts all this information together and shows how many countries have done this, thereby making it easier for other countries. So I unfortunately have to teach a class now, and I'm going to have to leave, but I do want to thank you for the opportunity to share these remarks with you, and also for the opportunity to hear all the other speakers. I'm just so sorry we couldn't be there in person, and I'm sorry that I have to leave, but I have to teach a class. So goodbye to all of you.
Thank you very much, Miriam. And I think one of the points that Miriam made that is really important and brings us to also think about not only about the countries that manage to achieve, but also the countries that have not managed to do so, and what are the key challenges that they're still facing. And I wanted to now ask and address that question, and ask Holly Wong to address that question, because we know your efforts to support the advancement of policies to tackle obesity worldwide, and including the application of SSB taxation. And I was wondering if you could mention some of the obstacles of those that did achieve their final result, but also the ones that are still struggling and trying, and what are the examples of how public health advocates are navigating these challenges and try to overcome such obstacles.
Yeah, thanks, Fabio. So I think one of the challenges that we've seen in a number of countries is frankly a lack of awareness about how ultra-processed foods and beverages, including SSBs, contribute to obesity and non-communicable diseases, particularly outside of the PAHO region, where these issues are not as high on the policy agenda and as much in the public discourse as they are here. But that's beginning to change, in part because of the work by public health advocates raising the profile of these issues and calling attention to the contributing factors to diet-related diseases, but also talking about the policy solutions that we know that are evidence-based solutions, and showing that those can work. But really, going back to what Marianne just talked about, the biggest obstacle to being able to advance these kinds of policies is strong pushback from the ultra-processed food and beverage industry, who see this as a threat to their profits. And as a result, they're pulling out all of the stops to undermine and to block policy solutions, whether it's taxes, whether it's front of package warning labels. The main argument that companies use for all of these policies, including taxes, is that they're going to lead to devastating job losses and economic crises. Arancho can talk much more about this, of course, based on the situation in Mexico, and you laid this out really well in your report. But there is no robust evidence that SSB taxes lead to job losses. And I think that's a really important part of the advocacy work that we do on these policies, to get this kind of evidence into the discussions, and to not let the companies use fear and false claims to block the policy solutions. But I think this is part of the bigger obstacle to getting these policies in place, which is industry interference across the board. And that takes multiple forms, as Marion talked about. It includes influencing and indeed paying academics to generate questionable data to support their positions. Often that's evidence that doesn't stand up to scrutiny. It includes companies polishing their image as good corporate citizens through social responsibility actions and using opportunities for what's often called nutri-washing, making their unhealthy products look more nutritious than they really are. And more importantly, giving companies opportunities to build their political influence with policymakers. Industry has done a great job at creating a narrative about themselves and about their products, that they're good corporate citizens, that they care about consumers and their health, that they're legitimate contributors to public health, and that their products are safe, their products are what people want and what consumers need, and that these are beloved brands and part of our families and part of our lives. You know, and so to this narrative, public health advocates are responding, and they're exposing what those industry tactics are and their objectives, and making clear that industry's priority is their bottom line, and it's really not public health. So I think having advocates working to implement evidence-based policies is important, but also having to have us work to ensure that the policy-making process is free of conflicts of interest, which I know is obviously something that PAHO is also working very hard on. So I'll stop there. Thank you.
Thank you so much, Holly. We have only 5 more minutes to go. So we're gonna try to accelerate so that we can finish as much as possible on time. So first of all, to our participants, 277 participants today. So thank you so much for being with us. We are very excited to have you all here. We have answered already 33 questions in the Q&A. And so thank you, Maxine, Fabio, Arancha, and Lisa for having done that. And participants, please look at the Q&A box. The answers to your questions are there. And now I would move over to the next 3 questions. I wanna read the questions for our 3 panelists, and then you will go one by one with the answers. So for Abdul, SSB taxes increase tax revenues, in addition to leading to healthy populations. Could these revenues help reducing fiscal deficits and fostering social development in the Caribbean? Then for Arancha, after the introduction of the tax on SSBs in Mexico, has there been any negative impact on employment in Mexico? And for Jeren, to close this, why is now more than ever the time to increase taxes on SSBs? Let's go to Abdul first.
Okay, yeah, thanks, Rosa. Very important question. Hopefully, you know, most people have read the publication because the answer to the first part of the question is directly related to how you structure the tax in terms of, you know, the revenue will be based on the type of tax to some extent, the rate, which will impact on, you know, what the effective price will be, and of course the tax base. Now the tax base is an important variable in this case, and hopefully I'm not going too technical. With respect to the elasticity, which will impact on the measure of how the price will, our quantity or the consumption will change with respect to price, and of course the price, the eventual price will be determined by what the effective tax is. Now, it's been shown and reported in the publication that the elasticity and with respect to the consumption demand for SSB is almost unitary. So what you have is that you won't have much change with respect to, you will have about the same rate of change in price as well as what you have in terms of consumption, which may not lead to much difference in the revenue. Now, depending on the specific situation, then you may have a modest increase in revenue, which will now contribute to plugging the tax deficit. Well, we have to go to what's the main reason for these SSB taxes is to incentivize positive health outcomes. So revenue is just an additional benefit. So no matter how small the tax revenue, then it's a win. It's an additional benefit. So whilst there may be some level of positive impact in terms of using SSB taxes to plug fiscal deficit, where the big win is in the social development part, where you can actually use the earmark. And I see a lot of questions about earmark, and Martin has been quite active with some of our comments and questions. And there was another question which I think Alisa responded to with respect to earmark. In the Caribbean, specifically, earmark will be quite useful because what you have is you have governments that are reluctant to impose these taxes, and you have the industry that may also be against it. And going back to my earlier point about the emphasis on the indirect impact or the economic burden, now you now have to show that these taxes that you are raising or the revenue that you raise from taxes should be earmarked to a large extent. Most public healthcare in the Caribbean is either free or highly subsidized, and government has to fund this. So if you earmark tax proceeds from SSB taxes to healthcare funding, that's a win. The government policymakers will listen to that. But what is more impactful will be in terms of directing this to healthcare, promoting health and healthcare promotion and NCD prevention, which will address some of the concerns that Patricia has. You know, you have the issue of culture. Now you have to invest in advocacy to say, even though we've been doing this, it's not good for us. We have cases, examples outside of the healthcare of NCDs where you have seatbelt law. People don't like it, but they have to do something that is good for them, even though some people prefer not to drive with seatbelt. People who drive under the influence, they know they shouldn't do it, but they still do it. The same thing applies to consumption of SSB, where people would do it even though they may not be aware of the issue of internalities. So we have to look at how we use SSB to actually advance social development, which would be a win. I don't know whether it's a win-win-win, but it's clearly going to be a win in the Caribbean context. Over to you.
Thank you so much, Abdul. Arantxa?
Yes, very quickly. So, so we evaluated the impact of the taxes on employment using the 2 years after the taxes were implemented. We didn't see any job losses in the industry that produces SSBs or in stores and we didn't see any impact on the unemployment rate. We didn't do any additional studies because the tax hasn't increased. If there is a plan to increase the tax, then we should look at that, definitely, and we have the data to do it.
Excellent, thank you. So earmarking works in the Caribbean, no negative impact on employment in Mexico. Sharon.
Thank you. I think the report, Lisa's presentation, Rosa, and all panelists have made excellent points towards why this is a triple or maybe even a 4 times win. So let me not repeat that. It really makes sense from all dimensions. But I also want to emphasize that we're saying human capital is so important, and low and middle income countries are trying their best to channel their very limited resources to quality of education, quality of health, and increasing access to these services. And we know that non-communicable diseases are hitting this very precious human capital, the lives of people at a much sooner rate than in high-income countries. So in low and middle income countries, people are dying or losing productivity because of non-communicable disease at a much earlier age. So this makes perfect sense to address non-communicable diseases with one of the most cost-effective ways, which is to increase taxes. I think also there's an opportunity here. What I noticed, and this is of course more anecdotal, there's definitely more coordination, collaboration, and openness between us in tax field, fiscal field, health colleagues, But I also see that with the COVID-19 crisis, this is also can be observed at the country level. Country authorities from Ministry of Finance, I think, are much more open and interested to hear Ministry of Health officials, because now I think it is more than ever evident that public health is really important. And factors like smoking and obesity are contributors to pandemics like the one that we're experiencing. And we have an opportunity to address together. Let me stop there. Thanks again.
Muchísimas gracias, Sharon. Muchísimas gracias a todos. Fabio, quisieras
Thank you
decir
very
algo?
much, Sharon. Thank you very much, everyone. Fabio, anything to say before we bring this to an end, before I move on to the wrap up? But no, I simply wish to thank you. We went over time, and we have been able to answer most of the questions. This has been very clear in answering most of the questions. Our panelists are very clear in answering, and we invite the public to read the document. We have many more questions that are answered clarified in the document. So we're very grateful. And back to you, Rosa. Lisa, who headed us in that process with the document. Any final words, Lisa?
In case
no, not really. I just think that all of the comments by the panelists were really helped to put all of this into context, and just really important to think about both the intended and unintended effects, and to be really armed with the evidence. And this is what we have tried to do with the document. You can't go wrong if you arrive at the policy table with facts in hand and strong arguments that make sense, and thinking about how those that you're concerned about, whether it be minority populations or lower income individuals, how you're going to in turn make sure that there's alternatives like safe drinking water for them, because at the end of the day, we want individuals to have that. And I just want to add maybe a fifth win, which could be to reduce plastic bottle use and help the environment, because those are added concerns that also contribute to health. So I'm going to pass it back to you, Rosa.
Muchas gracias. Si seguimos en este seminario, vamos a encontrar el
Thank you
sexto.
very much. And if we continue, we will find a sixth one. I'm sure that for the time being, let us stop at 5. So thank you very much to our panelists for having been with us today. Thank you to all participants. And I simply wish to close with 3 messages. The first one is that we don't have one single intervention that will help us solve the problem. But that, as Holly said, it doesn't mean that we have to wait until we move forward on all in order to make some progress. Let us move forward with what we can, always bearing in mind that this is a complete package. We have evidence to move forward on taxes, on SSBs in our region. We need more champions and more countries that will be moved and dared to implement the measure, and that we can learn from the implementation in real life. And we have an opportunity with ministries of finance that are interested in this context, but have also been interested from before in this issue, both in the Caribbean as well as in Latin America. And there was a request in order to learn more about the experience in Peru. I am Peruvian, so I will use that in order to commit myself to that. And I will invite Eva to help me with that commitment in order to disseminate the experience of Peru. They have a huge commitment by the Ministry of Finance. And I believe that we can go back to the request made by one of the participants, maybe in a future webinar. And I will close because we've heard a lot of references to Mexicans. I will close with some words that were shared by Marion. And I thought of a show that it is a show that almost all Latin Americans have seen, at least those of my generation, which is El Chavo del Ocho. And he used to say, when he used to go to that little school, that studying, anyone knows. If you go to school, anyone knows. And I believe that this is what Mario said. We have to do our homework. If you come to school with your homework done, and the most successful experience is what we'll have with us. Maybe not the first time, but the second one or the third one. So with that message, and I hope that at least it will bring a smile to your face. Anyone who goes to school can knows things. at least to have a smile on your face and in a positive attitude for this weekend. Thank you, everyone. Thank you to the interpreters. And we apologize if there was a problem with the sound. I know that your task is not always easy, but thank you very much for helping us out with this. And have a good weekend, and we'll see you next time. Thank you, everyone. Bye.